Cheaper flu vaccinations could be on the way. New laws have been brought in to allow pharmacists to give you the jab. Patients will have a choice. These medical card patients and indeed private patients will have a choice of going to the GP for a flu jab this winter or getting the vaccination at the pharmacy. We're joined now by Darragh O'Loughlin, who's the president of the Irish Pharmaceutical Union. Darragh, good afternoon to you.
Good afternoon, Damien. This is a good news story.
It is good news, and cheer people up, please. What's the story? How's it going to work? Are all your people ready to rock? Are you trained to give the jabs and so forth? And how many people have you trained so far?
Well, at the time of the influenza pandemic, swine flu, a year and a half or 2 years ago, more than 800 pharmacists in Ireland trained in administering swine flu vaccine, and one flu vaccine is the same as another. So we already have more than 800 pharmacists around the country who are trained to do this. The winter flu vaccination season kicks off in the autumn, and by that time we will have training in place so that any other pharmacist who wants to get upskilled to provide the service to their own patients and in their own areas will be fully trained and certified at that time.
Now, an important question, are there any risks in this? Because I'm not a medically qualified person, but, maybe some doctors will tell a patient to go away and they won't give them a flu jab. Will pharmacists do the same thing?
Pharmacists will do exactly the same thing. There'll be precisely the same protocols in place. All the safety aspects of it will be taken care of. And the risks that are there, the minuscule risks of allergic reaction to one of the ingredients in the flu vaccine and so on, all of that will be dealt with, and patients will be screened and treated in exactly the same way as they would be in a GP surgery.
So you'll get
we've committed publicly and previously to delivering cost-effective, convenient and accessible healthcare, and we have just been waiting for the legislative basis to do that. This, I would hope, is just the first of services that we can roll out through pharmacies in Ireland. Services that are available in pharmacies in other jurisdictions, where they're more convenient and more cost-effective. Yeah,
you mentioned the first service. There was also I think the morning after pill was introduced not so long ago, and that's been a success. What's the potential here? I mean, what kind of other services might you provide in the future?
Well, the next one that the Minister is committed to, and he is bringing forward legislation this autumn to do, is to provide for generic substitution, which effectively means that when somebody is prescribed a more expensive branded medicine, if there is an identical unbranded medicine or unbranded version of their medicine available, the pharmacist will be allowed to offer the patient the less expensive version. That will save money for private patients who pay their own prescriptions, but on the bigger scale it will save very significant sums of money for the exchequer who are paying for the medical card prescription.
So what, you can go into the pharmacy with a prescription for a very expensive prescribed medicine and you can say, I prefer the generic, please give me the generic?
Absolutely, and if there is a less expensive generic version there, the pharmacist will immediately just make that switch for you.
And when's that going to happen?
Well, what the Minister said is the legislation's in the pipeline and he hopes to have that before the Oireachtas this autumn. So hopefully, again, that's something we'll see over the course of the winter.
Now, the flu jab, back to the flu jab, how much is it going to cost in a pharmacy?
Well, no more than doctors' fees and other professional fees vary around the country. I would expect that pharmacy fees will vary, but they will be competitive because pharmacists compete with each other and we also have to compete with other service providers. Last year, only one pharmacy chain was in a position to offer this service, and they offered it, as I recall, at €30, which I think is a very fair price for a service like this.
Well, that's probably a bit high. We'd like it to be a bit lower if possible. There are reports floating around that the government pays the doctors €33 every time they give a medical card holder a flu jab, and that's going to be reduced now to 15, and that's what they're going to give your people. Is that true?
We didn't discuss fees with the Minister yesterday. Yesterday was just a preliminary meeting where we agreed that we were going to roll out this service. The key benefit for this is that we have a target population that we need to get vaccinated against flu every winter. Everybody over 65 and anybody with a chronic illness. We've never achieved even 75% of our target population. We're only in Ireland getting about 55% of them vaccinated. By opening up this extra channel, giving people another opportunity and a convenient opportunity to get the vaccination, we're hoping that far more people who should be vaccinated will get themselves vaccinated. And the massive saving for the exchequer here is going to be that people who are vaccinated won't subsequently get the flu, and we will ideally be keeping people out of GP surgeries and out of A&E departments this winter.
Yeah, but Darragh, if you can do people with medical cards, give them the flu jab for €15 and make a profit on it, is it not possible for you to do that as well for the rest of the country?
The charge that was there previously, included actually purchasing the vaccine, whereas what the HSE has always done previously for the medical card patients is they've contracted with the manufacturer and they've bought in 1 million vaccines, which I imagine allows them to get a massively better price than I can get when I buy a half dozen or a dozen vaccines into my pharmacy. The HSE then provides those vaccines to their own distribution channels to doctors. So what we haven't worked out yet with the Minister is the precise mechanics, whether the HSE will supply us with the vaccines or we'll be buying them and they'll be reimbursing them. So all of that has to be worked out before it's going to be possible to price up the service.
The details are still going through, but we need to get our skates on because it's July, and I mean the weather is absolutely terrible anyway.
We're coming up to the autumn and we need to start working immediately to put all the arrangements in place. So we've committed with the Minister that we'll do our part. Our people will all be ready to do this autumn. He has said that he's going to make whatever changes to regulation and legislation might be required to do this for his part so that we will be ready to roll in time to give people their winter flu jabs.
Now, Darragh O'Loughlin, you're president of the Irish Pharmaceutical Union. There's also the doctors to take into consideration, the GPs and the IMO. Do you expect them to be hopping mad about this? You're effectively taking their business away from them, and that, you know, you've done it on 2 occasions now at least, and you could be doing it again in another occasion, another issue in the next few months, maybe lots more besides coming up down the pipeline?
There's too much work from a healthcare perspective. There's too much work to be done in this country for anybody to engage in turf war. Patients aren't prizes to be fought over. They're the people that we have to serve. What pharmacy is about is providing convenient and accessible, cost-effective healthcare to patients. GPs work incredibly hard. I have a very good professional working relationship with all the GPs around me. I know the services they provide. I also know that this minister is absolutely committed to moving what services he can from hospital down to GP, down to primary care.
Yeah, he's a GP, an ex-GP himself, so he knows.
There's no shortage of work to be done. What we need to do is use the resources we have as effectively as possible, treat as many people as we can, keep people out of hospital, keep people healthy. And as the Minister has said, the way to do that is to treat them at the lowest level of complexity. That means that pharmacists are to do what pharmacists are capable of doing without restriction. And then GPs are going to take on work that's currently being done at hospital outpatient departments and so on. There's a massive reconfiguration of health services coming down the line.
There's plenty of work there for everyone. Listen, Darragh O'Loughlin, President of the Irish Pharmaceutical Union, thank you very much for explaining all of that in great detail to us, and thanks for joining us here on the Lunchtime programme on Newstalk 106. This is the Lunchtime